Hey, what's up, guys? It's Matt. So today was like the last in a series of what seems like endless exam. Well, not really even that. I actually have a mechanical ventilation exam next week, but yeah. So it's kind of the end of kind of my three classes that I have with one instructor. So I had the disease exam, and then yesterday we had the PFT exam for my basic assessment class, which I wound up doing really well on. I was a little worried about it. You know, it's just FEV1 and FEC and TLC and RV and FEV 1%. All and remembering what meant what, and then the algorithms for taking it and going back and forth across. Is it restrictive or obstructive? And looking at the various values that lead you to make an assessment based on those. So I was a little worried about that, and I wound up rocking that test and getting like a 48 out of 50 on it. So I was super happy about that. And then today, of course, was the doozy that everybody's been stressing about, was Farm, because he literally finished the end of the lecture yesterday. So naturally, if you had been studying, you wouldn't have had as much content to kind of cram. I had been studying so much for the PFT exam that I hadn't even looked at Farm, so I basically studied last night and then this morning. And it was the first exam of the day too, so it's not like we had all day to like study between breaks and during lunch and stuff. It was Farm was my first class of the day, so just luckily it covered like antiemetics, it covered opioids, it covered a bunch of drugs that I guess I was just comfortable with. I don't know, like maybe I already have a really good baseline of a lot of the drugs. I credit the discussions I've had with like my wife before, because in the GI lab where she works, they do like conscious sedation, and so fentanyl and Versed and propofol and the like, we hear about a lot. We talk about a lot, me and her, and just the different little things about that. And in her time on the floor, they had a lot of Dilaudid and morphines and codeines and all that kind of stuff. So I was pretty confident in those drugs. And so there was only really a handful of drugs that I really wasn't as sure about, like some of the antithrombotics and stuff like the Coumadins and warfarins. Like I know what they are, but then you had like the Lovanex, the low molecular weight stuff. So it was, and then just some of the other stuff. So obviously Farm tests aren't just memorizing a bunch of drugs. That's one part of it, but it's also the how they work, the physiology behind they work. So it was a lot of stuff. We covered like 2 chapters worth of Farm on one exam. So we're all kind of nervous. But as I got to about the 10th question on the quiz, it just hit me. I'm like, wow, I was really comfortable. It felt easy. Like it felt like I was well prepared for it. So after that, I kind of breezed through the rest of it, and wound up getting a 48 out of 50 on this exam too. So I was kind of blown away for how much I studied and how confident I felt going into it, or I guess for lack of confidence. I expected a lower grade. So I was really happy about that. And then he wound up throwing a question out that was just statistically a poor question based on the stuff he looks at. So I got a 49 out of 50, and I was super excited about that. That's, pharmacology is a difficult class. And what was even better for me was that getting that A on the basic assessment test and the A on this test actually brought me back up to A's in both those classes too. So I'd slipped down to B's in those classes. And I was right on that cusp of almost back to an A. So I actually have A's now again in those classes. So I was really excited about that as well. And then afterwards we had lab, and we're heading into basically our last module is covering X-rays, reading them and assessing quality and things like that. So that'll be my last basic assessment module. Basically, that's what it'll cover. So we had a long lab. We pulled up some videos. So I'd mentioned the MedCrim guy for the ABGs before, and he does a really good one. And there was another one, and I'd actually had a discussion with my professor before, kind of about the MedCrim videos, how I enjoyed them, and thought he did a pretty good job of not oversimplifying them, but getting to the point where just things that were easy to remember. And he'd mentioned this guy who actually showed us a few videos of this guy today, but it was all on chest X-ray assessment. So off the top of my head, I can't remember the name of the channel. I want to say it was something like Dr. Strong or something like that. I'll find the link, and I'll put it in the description if you're interested in learning about chest X-rays. And then for me, it was nice because it kind of built upon some of the knowledge I'd gained during the couple of in-services I got to sit in at my clinical days. So we had a radiologist who was doing a little sit-in in-service with a PowerPoint about chest X-rays. And he's a radiologist at the hospital that we're at, and he's also a dual specialty, so he's actually a pulmonary fellow. So that's why he was kind of catering to the respiratory department a little bit with this. So it was cool. Just and basically what we did is we just jammed across a bunch of different chest X-rays, and he was asking us almost like a discussion, like, okay, well, basically, does this look normal? What do you guys think? Does the heart look big or small? Or he kind of went over how he assesses chest X-rays as to not miss anything. In the videos we watched today, they talked about a different method, so doctors will kind of develop their own way, and it's just kind of nice to know, kind of just at an idea what to look for, and he was just talking about, obviously we're focused on the lungs, and we do look for other landmarks like bigger intercostal spaces, like when there's more space between the ribs, basically. But he said, and that's all great, and you don't get so focused though that you're looking at chest X-ray, and you more from a physician standpoint, but send a patient on because you just looked at the chest X-ray really fast and you missed something totally obvious, like a fractured collarbone or something. He's like, so he had a really good process for looking at him. So it was really cool to build upon that knowledge and see, hey, what the heck was going on here. So it was really cool video, and this guy's video did focus on a lot of the we did look over the bone, but things to look for with the heart and mediastinum, and it was pretty thorough. So like I said, I'll get the name of that channel and maybe a link to his channel or the video series to see if and that way if anyone else is interested in watching it, it'll be up there for you. This guy, he was a little more, his graphics were a lot better, I think, than MedCrim, because that guy kind of does that digital drawing. This guy actually had, like, it was almost like pictures, almost PowerPoint style, but some of his graphics were a little better, although he talks a little more, not quite monotone, but, a little more boring to listen to. Like, if you're tired, it might put you to sleep. But, yeah, so anyways, guys, just update, jamming away at exams. I will also do a video where I'll recap my last Friday I went to the Arizona Society for Respiratory Care's student conference. So I'll just kind of I'll recap just kind of what we did, what we talked about in my next video for you guys. So anyways, take care, everybody. I hope everyone's doing well in school. Have fun at clinicals, get lots of ABGs, and I will talk to you guys soon.